So Christine, what is your role at Weight Loss?
My role at Weight Loss is as a bariatric physician, so I work alongside our surgeon, Mr Kevin Dolan, giving follow-up care of our patients before surgery and after surgery as well.
What are the most common medical conditions people that are overweight present with?
Yeah, so our patients come in with lots of, varied medical conditions. So we know the real common ones that everyone knows related to being overweight. So blood pressure, diabetes, high cholesterol, but there's a whole range. So often our patients will come in with reflux, so gastroesophageal reflux disease, bit of indigestion, night coughing at night. But we also see lots of patients struggle with back pain, knee pain, hip pain, and just generally having a lack of physical, not being at your optimum in terms of energy-wise. We also see patients who just feel a little bit tired, lethargic, maybe mood symptoms getting a little bit down because of their weight. And that also interplays with other things like fertility issues as well, and in the personal relationships too.
So when it comes to the surgery, what advice do you give patients before they have the surgery?
So it's dependent on the type of surgery you have as well, but it's always nice in the beginning because surgery is a big step, and we like our patients to be very much understanding of what is coming up ahead for them, and also to provide a platform and a starting ground for where they can go from for their surgery. So it's nice to come and meet and greet, to know all the different members of the team where I fit in as well, alongside with Dr. Dolan, and so just to get to know who's the face, who you can have a chat with and come in and as your support mechanism behind. Then we also like to sort of prepare patients a little bit for surgery itself too, giving you an idea of what's coming up, what to expect, and that'll depend basically on which procedure that you're going to have as well. So specifically for the gastric band, I think it's really important to come in and have a good chat about what you're expecting, what do you think is going to happen with the surgery, and of course any questions that you may have about the operation itself. So there's a couple of key things that I tend to go through with patients, and the real key with the band is, it's been around for a long time, and lots of kind of information out there, whether you've read online about it or someone who's had the band, or you've seen things, on videos online. We like our information for patients to get nice standard, expect, what's really truly to come. You may have heard patients mention, I've got so-and-so next door and they've got a band, I always see them throwing up, or often we go out and they whip off to the bathroom and they always bring up their meal and they're never at the table. So we really love our patients to say no vomiting with the lap band, and really we want you to sit with, with your meal, with your family, with your friends, enjoy the meal, and not feel that you've got to run off and excuse yourself to the bathroom too. So I do a lot of education just around, your eating behaviours, and I often say to patients, look, just think of the band. It's going to be a tool that you're going to have to help you lose your weight, but on your end, you've got to do your little bit as well to agree with the band too as well. So we go through a lot about how to eat the right way with the band, what kind of foods are the right things to do with as well, and definitely to avoid the pain and the regurgitation and the vomiting with the band.
What about after the surgery? How often do they need to come and see you afterwards?
So we always say follow-up is the key. So if you think of your band, think of like your car tyre, you've got to always maintain it, pump it up, give it a bit of love every once in a while. Think of your band in that way as well. So the follow-up really is the key. In the beginning, we like to see you often, maybe once a month for the first 3 months, and part of that is to adjust your band so we can get it up to a nice level where you're feeling satisfied and you're happy with your small meal portions as well. But at the same time, you're going to have lots of questions, am I doing this the right way? Is this how I'm meant to be feeling as well? So it's good to come in and for us to consolidate that advice with you. And at the same time as well, give you that encouragement, you're doing well, you're on track, and it's all going in the way that you're expecting as well. As time goes on, we might stretch you out a little bit, maybe see you every 3 to 4 months for the first couple of years, and then normally we say once a year touch base with us once you're steady, just so we can make sure you're on track, do all your blood tests, make sure all your vitamins and nutrition are on track too.
So why is it so important the need of the adjustments then?
Yeah, so the adjustments of the band is to give you that satisfaction so that you feel no longer hungry with the small meal portions that we're advising you, but also to make sure that you're eating the right types of food. So on one end of the scale, if your band is too loose, so you might find, look, I can eat a much larger portion. I tend to be hungry quite quickly after a meal, so maybe an hour or two you've been starting to think I'd like to have something a little bit extra. Or you might find that you're not losing weight or you're even gaining a little bit of weight. On the other end of the scale, maybe your band is actually been done up a little bit tight and you're a bit over restricted, so that's where you actually find, well, I've put my little nice bit of food in front of me, but I'm sitting there for 45 minutes to an hour slowly picking at my meal, or potentially it's hurting while you're eating, food's coming back up, or you're having to excuse yourself to bring something back up. Or you may find that I can't have that nice bit of fish and vegetables, I've got to put lots of sauce on it, or I'm finding if I have something melty, something crispy, something a bit sloppy, that goes through, and that gives us the indication, maybe we need to take a bit of fluid out of your band to make it a bit better.
Is it painful getting an adjustment?
No, not at all. So that's often a question that we get asked. So even if you're afraid of needles, most patients will say to us, actually, hey, that wasn't too bad, not as I expected. It's a really quick procedure. So we do it just here in the rooms. It's a quick needle into the belly. It'll hurt half as much as having a blood test. And, it's over before you know it. And we just use sterile water, so nothing fancy that we put into the band as well. Yeah, so most patients are perfectly fine.
So what kind of weight loss can a patient expect after surgery, and how long will it actually take for them to reach their ideal goals?
Often we're asked that as well, and we like to have a chat about your weight expectations before surgery, because we've got to put it into context really. So often I say to patients, look, give up that idea of dieting, so it's not that we're going to come and give you here's a new fancy diet that you're going to have. It's about changing your lifestyles and your behaviours. So we do normally say with the gastric band 18 months to 2 years to lose your weight, but everyone's going to be different. So it depends on what size of weight that you start off with. Do you have 50 kilos to lose, or do you have 15 kilos to lose? So that would alter things as well. But generally we say, look, we expect to achieve what we call a 50 to 60% excess weight loss over that time frame. So meaning if you're 10 kilos overweight, we expect you to lose the 5 to 6 kilos over that 18 months to 2 years. But everyone's going to be different at the pace that they go. But if you aim maybe for about half a kilo to a kilo a week, that would be a reasonable pace to go to. But every time you come in, we have a chat, where are you sitting, how's all the things going, and we put everything into perspective as well.
So can you tell me why some patients just simply don't lose any weight?
Yeah, which is a really good question. So, weight loss is hard, and we understand that for most of our patients who come in, it's been a lifelong issue. So often you've struggled for many years with your weight, and we understand there's many reasons that interplay into it. So sometimes it's what's going on in the background, something in the family, something work-related. Sometimes your lifestyle is just too busy for what you're trying to fit in all the things that we're asking you to do. So I think the real key is recognising that it is tricky, and often we say do as we ask you to do, so come in and see us when we recommend, have the support, follow the advice that we give you to do with your band, and stick with what we ask you to do in terms of what types of food to put in, the exercise alongside it, and coming for your follow-up appointments, and having your adjustments as well. But with that I say, hey, life happens, so sometimes you're absolutely on track, you've done wonderfully well, but something in life happens and that pulls you away a little bit from your follow-up, or you fall back into your eating behaviours as well, and that's when I say pop back in. We're never going to get upset at you when you come back, and when you struggle, that's when you need us, and sometimes it's just putting it into perspective. Maybe you've gained 5 kilos, but you're still 15 ahead of the game, so we say, hey, not all is lost, and sometimes it's just that reminder, because you're used to your headspace telling you, this is how it's going to be, you've lost and now you're slowly regaining, but I think that's really the key as well, to recognise that there's other things going on, and for us to kind of give you the avenues to address those issues as well.
That's great. And just lastly, can you tell me about some of your real success stories and how they have stood out? And how you've
absolutely.
lives?
It's a really exciting area of medicine to work in. We see everyone from different walks of life. So, we've got quite young patients who come in. Your late teenagers, early 20s, right up to your, ladies who are 60-odd years. But I think the ones that really stick out for me are probably your younger patients, So, when you're 20, 18, 21, you're at that stage of life where you should really be enjoying yourself, confident, going out, being social. And you do see a lot of them when they first come in, they're a little bit, reserved, a little bit, drawn back just because of what their weight has limited them from being. But, once they lose their weight, so we've got patients that maybe 100 kilos, 110, 120, and they get down really well, lose 40, 50 kilos, and you see that come out of them, so they blossom. Confidence comes out, they pick up with their social life, they're out with their friends. For girls, just shopping in a normal store, not having to go up to the extra plus size sections, and for them to go through university and really blossom into, into the adult life as well. The other ones for me is really also the couples that are trying to fall pregnant. So we often see ladies or men, they've been trying to fall pregnant for a while, gone off to see, their fertility specialist. But once they lose their weight, things get back on track, ovulations, back in order. For the men and the women, their weight's optimised, and that just works really well for conceiving. And of course, the joy of having that has really been lovely. So it's been great. Yeah.